Mrs. Drinkwine, how are you today?
Doing okay.
Good. My name's Sabrina, and I'll be your SPT for today. Have you ever been to physical therapy before?
No.
No? Okay. So what we're going to do today is we're just going to do an eval to start off with. The first 15 or 20 minutes will be us just talking like this, just me getting some more background information on you, kind of getting to know you a little bit better. And then hopefully the last 30-45 minutes we can start with some light exercises depending on what I find.
Okay.
Does that all sound okay?
Yep.
Cool. And then I'm going to be taking some notes as well during the process. Is that okay?
Yeah, it's good.
Perfect. Okay, so what is your date of birth, Mrs. Drinkwine?
It's 10/9/94.
Okay. And just so I can get some background information on you, what do you do for work?
I'm a dancer.
You're a dancer, okay. Where do you dance at?
At SeaWorld?
At SeaWorld, wow. That's super cool. And what kind of dancing at SeaWorld do you do? Like, what kind of physical activities does that entail?
So I kick out a lot, like high kicks and whatnot, spin, raise my arms up above my head, but I also wear a 30-pound costume while doing that, so it's kind of difficult.
Yeah, that's pretty challenging.
Yeah.
Very challenging. Okay, and what do you like to do for exercise, Mrs. Drinkwine?
I like to run.
You like to run? Okay, about how often do you like to run?
We're like 2 to 4 times a week, and I had been doing it for like 8 months before my injury.
Oh, okay. Were you doing it like just for fun as a hobby, or were you doing it competitively?
I just really needed to lose weight. You know,
Okay.
being a dancer, I need to make sure I'm in shape, so.
Okay, well, I know that sometimes with an injury it can kind of stop people from trying to lose weight and continuing on that plan. Have you thought about anything else you can do to possibly continue losing weight while you're injured?
I was thinking about swimming, but I'm not sure if that'll like make it worse or anything.
I think
but-
that's awesome. I think you should definitely try swimming. I think
Okay.
that would be a great alternative while you're injured.
Cool.
Okay, and how about hobbies? Are there any hobbies you like to do on the side?
I like to paint every now and then.
Okay, cool. That is awesome. It's a really good stress reliever.
Yeah, for sure.
All right, and what about your living environment? What kind of place do you live in? For example, do you live in an apartment, a house?
So I live in an apartment right now, second floor. So.
Okay, so you have to take a flight of stairs, correct?
Yes.
Okay. And how are those stairs for you?
Pretty difficult.
I imagine.
Yeah, especially with the crutches.
Okay, so you have crutches. Okay, and do you live with anyone in your apartment?
Just me.
Just you? Okay. And I know you said you had crutches. Who gave you the crutches? And was it a doctor? Was it a family member?
So when I went to the ER, they gave them to me there.
Okay, so the ER gave them to you.
Mm-hmm.
Okay, and how long have you been using the crutches for?
It's been like about 4 weeks.
4 weeks?
Mm-hmm.
Okay, and have you had any problems with the crutches? Have they been helpful for you?
They've been helpful, just a little painful underarms.
Yeah, so that is a problem that I hear about a lot, is having a lot of pain on the underarms just because they're not used to having that much pressure there all the
Mm-hmm.
time. But hopefully we can take care of your problem and we can get you off those crutches as soon as we can. Okay, and the next thing I want to ask, why are you here today, Mrs. Drinkwine? What is your main complaint for me?
Leg pain, just really bad leg pain.
Your leg pain? Okay. And where exactly on your leg are you feeling pain?
So just like under, like where my thigh
Yeah,
is
can
and
you
back.
point for me?
Just like right here.
Okay. So right kind of in the middle of the back of your leg.
Yeah.
Okay. And do you have pain in your knee by any chance?
No.
Okay, what about your hip? Any pain at the hip?
Nothing there.
Nothing? Okay, what about the front of that leg? Any pain at the front? No? Okay. And what about the other leg? Any pain on the other leg?
No, just that one spot.
Okay. And also, what kind of pain are you feeling? Sometimes pain can range from feeling dull, achy, sharp.
I would say it's pretty sharp.
It's a sharp pain?
Yeah.
Okay. And if you had to rate that pain on a scale of 0 to 10, 0 being the worst, or 0 being you are completely fine, and 10 being the worst pain imaginable, what would you rate your pain?
I'd say it's about a 6.
Okay, and that's your pain right now?
Mm-hmm.
Okay. And what is your pain at its best it's ever felt?
Like a 0.
A 0. And what about the worst it's ever felt?
Maybe about that 6.
About that 6. Okay. And what are some things that make your pain worse? So activities that you do, maybe running or something like that?
So definitely walking and dancing.
And dancing, walking and dancing, okay. And how long does it take for the pain to come on once you start walking or dancing?
I'd say about 2 minutes for both.
2 minutes for both. Okay, and how about what makes your pain feel better?
So they gave me medication at the ER, so I've been taking that. I ice every so often and rest, just sitting down and resting my leg.
Okay. And for the ice, what kind of ice do you usually use? For example, do you use an ice pack? Do you use just some bag of cold peas that you have in your freezer?
Just an ice bag, put ice in it, and then just put it on my leg.
Okay. And about how long do you ice for?
Maybe like 20 minutes, like twice a day maybe.
Twice a day. Okay. And what else did you say made your pain feel better?
Rest.
Rest?
Yeah.
Okay. And how long after you ice or rest does it take for your pain to go away?
Maybe like a minute, or it's pretty immediate, so.
Pretty immediate. Okay. That's good. Well, I'm glad to hear your pain isn't lasting for crazy long after those things. It's not good to be in pain all the time. So I know you said those things help you, but what other things do you think you could do to help your pain?
I think maybe like stretching. I know stretching's good for you, as a dancer, we're always doing that. So assuming maybe that.
Yeah, I think stretching would be really beneficial for you. It's always beneficial. Just be careful and make sure you're not overdoing it with your leg. And your symptoms, whenever you wake up in the morning, how does your pain feel when you first wake up?
Pretty stiff, like kind of a little painful.
Pretty stiff. Okay, what about throughout the day? Does it change at all throughout the day?
I think the stiffness goes away, but the pain gets worse.
Stiffness goes away, but then pain starts?
Mm-hmm.
Okay, and what about in the evening or at nighttime?
Just as bad.
Just as bad? In what way is the pain worse at night? Why do you think it's bad at night?
I think just putting all the weight on it throughout the day.
Like weight bearing?
Yeah.
Okay. And does that pain stop you from sleeping at night? Do you have to take anything to fall asleep?
I usually take maybe like an ibuprofen or something, and then I'll be able to go to sleep.
Okay. And about how much ibuprofen do you usually take?
Maybe like 2 pills, maybe.
Okay. Okay. And is it okay if I just pull out this form that you had filled out earlier just to go over some medical information I have from you? Okay. So I have up here that you learn best by doing things. Is that correct?
That's right.
Okay, so I just wanted to explain why we asked this question. Physical therapy, some people might think that's a little strange, but basically we just want to make sure we are catering to you and we're making a program that fits your specific needs, just so you can be more successful and so that you can get back to your daily life as quick as you can.
Okay.
Does that sound okay?
Sounds good.
Cool. And I know that because you said you liked to learn best by doing, we will make sure to demonstrate all the exercises for you and have pictures so you can remember better.
Yeah, that'd be great.
Awesome. Okay, and then I also saw on here that you said you checked yes for feeling down, depressed, or hopeless sometimes. Can you explain that for me?
I just, I haven't been able to work, and it's been really tough because that's the way I make my living. So I've just been feeling really anxious about that. And I just want to get better,
Yeah. Is there anything that you can't do anymore because of your injury?
So both the running and the dancing, pretty much anything on my leg is just really hard for me to do now.
Yeah. Well, when you couldn't do those things in the past, is there anything else you started to do instead that has helped you?
I would read, kind of take my mind off things.
Okay, well then maybe you could try that. Maybe instead of dancing or running for a little bit while you can't, maybe you could try reading, and that'll help ease your pain and give you some stress relief.
Yeah, I'll definitely try that.
Yeah, sounds good. And it says on here that you do not use tobacco, but you do drink some alcohol. Is that correct? Okay, and it says you drink about 4 drinks per week. Is that correct?
Yes. I just like to go out with my girlfriends every now and then.
Totally get that. Another great stress reliever.
Yeah.
Going out with some friends, that would be fun. And then on here I also saw that you have no medical issues for yourself or your family regarding cancer, diabetes, blood pressure, heart disease, stroke, all that.
That's right.
Is that correct? All right. Next thing I noticed, you didn't check anything for having asthma or bronchitis, so I just wanted to double check. Have you ever had any issues with those in the past?
No, sorry. I guess I just totally slipped my mind to circle
Yeah,
it.
no worries at all. That happens all the time. Just wanted to double check before we move forward. And I see that you do have some anxiety. Want to explain that a little bit for me?
I guess it was kind of what I was saying before about, not being able to go to work and just feeling down about everything.
Yeah. Okay. Well, maybe you can try some of those reading or painting things that we talked about to help stress relief.
Yeah.
Yeah, I think that would be awesome for you to do. And was that anxiety, is that, were you diagnosed by a doctor with that, or is that just some anxiety that you feel sometimes?
Just what I feel, yeah. I don't think it's bad enough to go to a doctor, so.
Okay. I totally understand that. And have you had any, I saw you checked yes for having traumas. What kind of traumas have you had?
When I was 18, I was in the cheerleading team, and they dropped me, and so I, hurt my hip, and it was awful.
Dancing again.
Yep.
Okay, and did you have any images or surgeries done for that?
Yeah, I had a surgery when at 18, hip surgery from the accident.
Okay, and was that the only surgery you've ever had?
Yeah.
Okay. And how does that heal? Has that healed pretty smoothly?
Yeah.
No problems?
No problems with it.
No problems? Okay, perfect. And the last thing I wanted to go over on this chart was that I saw you checked yes for difficulty sleeping because of stiffness. Yeah. Oh, I'm sorry, not difficulty sleeping, just morning stiffness.
Oh, yeah. Yeah, it's just there when I wake up.
There when you wake up.
Takes a little bit to go away, but it finally does. It's just pretty uncomfortable, I guess.
Right. Yeah. I totally understand that. We'll see if we can try and figure that out here. Okay. I appreciate you clearing some of that stuff up for me. I just wanted to make sure I had all the information correctly. Next thing I wanted to go over, did you have any imaging done for your leg?
So I got an x-ray and an MRI.
You had an x-ray and an MRI? Okay, and what were the results for those, do you know?
I think they just said that I had a strain, I believe. That's really all they told me.
Okay, sounds good. So they said you had a strain of your leg? Okay. We can definitely double check with your doctors just to make sure we're not missing anything here. And I know that you said earlier you were taking some medication in order to help ease your pain. What kind of medication are you taking?
So I'm on Mobic right now.
You're on Mobic? Okay. And about how much Mobic are you taking?
Like 200, 400, somewhere around there.
Okay, 200 milligrams?
Yeah.
Okay. We can definitely check and make sure, just so we know. And I think earlier you said as well for the easing, for some things that help ease your pain, that you're taking ibuprofen.
Yes.
As well. About how much ibuprofen are you taking?
Oh, maybe like 200. Not much.
Okay. And about how often do you think you take that ibuprofen to help you?
Just really at night.
Just at night. Okay.
So I guess it's
So
like once.
Once a day. Okay. Sounds good. And have you ever injured your leg before?
No.
No.
Not the leg.
You've never injured your leg before, so this is the first time? Okay. And so tell me what happened. How did you injure it this time?
So I was standing on a pot, I know, kind of dumb, trying to hang up some pots, and I just fell off, and my dog was right next to me, and I was about to fall on her, so I extended my leg out to try to miss her, and just fell really wrong on it. My leg was extended, and it was just awful.
Oh my goodness. I'm so sorry to hear that. But hopefully we can get that figured out and we can get you back to dancing and running in no time.
Yeah, that'd be great.
Yeah. And something else I just wanted to go over. So I wanted to make some goals for the both of us. I think it'd be really awesome if we could come up with some goals together that you have here to really progress in physical therapy.
Okay.
Is there anything that you had in mind for what you want your goals to be?
I mean, getting back to dancing would be great.
Getting back to dancing.
Also running.
Dancing and running?
Yeah.
All right, sounds good. Well, we will definitely try and make those things happen. And that actually concludes this part of the evaluation. So those are all the questions I have for you, but do you have any questions for me regarding the process or just physical therapy in general?
guess I'm just a little nervous. I had a friend who went to OT and she didn't get better, and I'm just scared I'm going to re-injure myself just moving around and doing everything.
Oh, no. Well, I'm so sorry to hear about your friend. I know that sometimes when your friend has a bad experience, sometimes that must make you feel overwhelmed and anxious about this experience. But here in physical therapy, we are really going to take some good care of you, and we just want to get you back to optimal health.
Okay.
And I want to let you know, if you ever don't feel comfortable with anything that we're doing, or if you don't like it, please just feel free to let me know. We can definitely change it up in order to accommodate for you.
Okay, that's great. Thank you.
Okay, you're welcome. And are you about ready to start some exercises?
Yeah, let's do it.
Sounds good.